TRT and hair loss. So a lot of people are worried about hair loss when on hormone replacement therapy. Like anything else, there's more than just take testosterone, you're gonna lose hair. So testosterone itself doesn't directly cause hair loss. However, if it gets converted into DHT at too high of a level through an enzyme called 5-alpha reductase, that is what's associated with hair loss. What happens is the hair follicle becomes miniaturized, leading to a condition called androgenetic alopecia or male pattern baldness. However, it doesn't happen to all men. Most of the time, if your mother or father had issues with hair loss at an early age, then it can mean you may be genetically prone to this. Now, it varies among individuals, influencing whether it's gonna happen to you or not. So there are people that are put on these medications that block the DHT conversion called 5-alpha reductase inhibitors. They are good for some. So if your hormones are already optimized, it is something that adding this at low doses can benefit you with minimal side effects. Now, if you are taking this drug and your hormones are already messed up, that's where you can get some side effects such as low libido, erectile dysfunction, depression, and even suicidal ideations in some. However, it is not as apparent as people think, but it is important to weigh the benefits and risks when you're getting put on some of these drugs. So go into a clinic that will help optimize and minimize the side effects of testosterone and the conversion to DHT, and at the same time give you potentially low dose finasteride is more beneficial than being put on high doses of this drug. So it really is important if you're gonna get put on one of these drugs to one, make sure your hormones are optimized, and two, that you're not on too high of a dose of finasteride. There's also a lot more data coming out showing a direct link between hair loss and deficiencies in certain vitamins and minerals. If you optimize the following vitamins such as vitamin D, vitamin E, iron, copper, and biotin, these will help mitigate your side effects. So this is why it's important you got to go to a clinic that will check these levels and really make sure that we're looking at the whole picture. So like anything else in the world, before we blame and stigmatize testosterone as the cause of hair loss, we really must rule out other deficiencies. The benefits of optimizing your hormones far outweigh the potential side effects of hair loss. More importantly, well-managed hormone therapy is the way to get the most benefits with the least amount of harm and side effects. There's also other treatments available for hair loss, which we could talk about in another video. Now, if you want any more personalized advice, feel free to reach out to us. Our goal is to help you look better, feel better, and perform better in all aspects of your life. Get started today.